Okay, good morning and welcome to today's promised town meeting talk show, one that I am particularly eager to bring you because of the value of its content and the fact that it's not just me going on and reading about things. First off, we point out the important fact that the show is sponsored by Cordova Wireless Communications. They are your local provider of cell phone and wireless data services. When you are a customer, those dollars you invest with them do not leave and go elsewhere. They stay here and circulate through our community. And that local business is providing your local talk show here on KLAM, which is also a local business, and that's a very big help. So we're able to do things like this. Incidentally, this is the Friday, May 1st show, Uno de Mayo. And again, I'm particularly excited about this show because I was able to have a joint visit with two of our strongest local voices in the field of mental health. That would be Barb Jewell, Behavioral Health Program Manager of Sound Alternatives, and Matt Rush, Behavioral Health Coordinator for the Ilanka Clinic. I'm sure you're aware that medical institutions in many ways across the country and the state and here in Cordova are coordinating in ways that maybe in the regular course of business wouldn't happen quite as much, but obviously in these pandemic times that's very, very essential. Not to mention Cordova is great about coordinating and trying to not overlap services in general. It's just something that we have a sort of an instinctive sense for that you don't see too many other places. And of course, the role of behavioral health has been continuing to gain prominence as everybody's lives are changed by what's going on with the lockdowns and the changes in the business structure and associated changes to people's incomes and abilities to provide for themselves and for their families. Mental health professionals across the country are waving the flag and saying, hey, part of this conversation needs to be about not only avoiding the virus, but also being aware of and dealing with the consequences of people having to stay home all the time that aren't used to that, which doesn't mean staying home isn't a good idea, but that's going to change how some people feel about their lives, and we need to be aware of that problem and ready to respond. You've got this phenomenon of people that have not suffered from anxiety or depression when things are normal, now facing that, possibly without realizing it. And then managing things in a way that you do what you can, again, obviously to protect people from infection, but also avoid people that are struggling with this temporary new normal that may be inclined towards substance abuse, mental health and behavioral issues, or worst case scenario, even suicide over the long term. That maybe as the disease curve flattens, you start to see an increase in a suicidality curve, and nobody wants to see that. So with all of that in mind, and of course local issues, I have looked forward to this opportunity to chat with Barb and Matt. And by way of introduction to this segment, they put together a sort of a joint introduction for me to share with you. We're living in a challenging environment. Not only concern about catching the virus or spreading the virus or knowing someone who gets sick and dies, but the challenges of sheltering in place, isolation, economic impacts to individuals, families, businesses, and community. This event touches every facet of our lives, and we don't know enough to be able to judge the danger. We also don't know when it'll end. The conditions we are in are almost diametrically opposed to what we strive for as human beings: connection, safety, predictability, and control. Instead, we're now in an environment dominated by volatile circumstances, uncertain circumstances, things that are chaotic, and things that are ambiguous. Stress, fear, anxiety, and depression are not uncommon reactions to this kind of environment, but there are strategies for managing these reactions and strengthening our coping skills. They include making sure we eat well, sleep well, get physical exercise, and keep communicating with friends and family. We have resources in Cordova to provide more information on these strategies and help for people who need it. End quote. And so with that, let's listen to the conversation that I feel very privileged to have had with Barb and Matt on today's edition of the Town Meeting Program. Our guests, Barb Jewell from Sound Alternatives, Matt Rush from the Ilanka Community Health Center, and again, our subject, mental health issues surrounding these rather challenging times. Barb, why don't we start just by, for the benefit of anybody who doesn't know you and your role at Sound Alternatives, just sort of introduce yourself a bit, if you would.
Sure. Thanks, JR. I really appreciate that. My name is Barb Jewell. I am currently the program manager for the Behavioral Health and Developmental Disabilities program at Cordova Community Medical Center, also known as Sound Alternatives. I've been working in the field of social services for over 25 years and have had the great opportunity to do anything from street outreach to placing foster children to case management to inpatient psychiatric services. I currently manage the services here, including counseling and therapy, as well as all the developmental disability services for the community.
Okay. And then Matt with Ilanka, tell us a little bit about you.
Yeah, thanks, JR. I am a licensed professional counselor at Ilanka. I am the behavioral health coordinator here. I've been here for about 7 years. I started my career in school counseling and moved up here to Alaska and got my licensure here and do chemical dependency counseling. Also run a medication-assisted treatment program as well. And that about sums it up.
Great. Well, and in great, in classic Cordova style, in my opinion anyway, the fact that while you both work for different institutions, that you have this alliance and this mutual interest in the behavioral health issues that could be facing Cordovans at a time like this is just very much the Cordovan way of doing things. So my thanks to you both for being willing to join us in tandem. And we want to cover some kind of key areas that can create, they're just creating challenges, to put it euphemistically, and just outright difficulty for some people. One of which, and Matt, maybe we'll start with you on this, one of which is that parents have suddenly been thrust into the role of having to be teachers, but there are other responsibilities that they're used to taking care of while the kids in school, in many cases, have not gone away. So what are some strategies that you could offer, or tips for people that are maybe having a hard time dealing with all of that?
Yeah, that's a good question, JR. I'm a parent myself, so I'm seeing the challenges as well. And one of the biggest challenges is, it's the environment of which the kids are being asked to learn in. So the school environment, there's an expectation to learn, and they go to school and they have these expectations, and things tend to go well. And when they get home, things are much different. And so it's difficult to get them to change their mindset and to be able to get into a learning environment. So one of the things you can start doing is designate a school area. If you have a school desk or something that might mimic their school environment, that's a good place to start. The next thing that's very important is the school system runs on a tight schedule. They have a very, not just a tight schedule, but a very detailed schedule that's typically up where the children can see it. They know what's going to happen next. It's good to be able to create that for them so that they know exactly what's coming. Another thing that you can do is really has to do with sort of a behavioral piece in psychology, which is most parents know this, not giving in to your child. When you set the schedule and you set this environment and you have an expectation, they're going to want to get out of it. And the moment that you do let them out, they know that they can get out the next time. And so it's going to be increasingly more difficult to get them to start learning the next school day. So hold your ground and do the best you can. Another piece to that is the positive reinforcement. I do a lot of work with what's called a token economy systems with parents and children. The positive rewards are very important. I think we tend to focus on a lot of negative punishments or taking away toys and that kids have sort of an endless supply of. And we know that that's not very effective for motivating children. So one thing that you can do is you can create sort of a point system where they can earn points when they finish a certain subject matter or a task. And you develop what's a kind of a store where you can put these motivators in that store. It can be anything in the store. Toys, small toys, candy, parental time, extra time with parents, and the more variety that you have in the store, the better. One of the main sort of human fundamentals is that we all are motivated by variety. So developing that for your children, and every child is going to be different. You just need to be kind of a scientist to figure out what's going to motivate them. A couple more things. A timer is really important. If a child doesn't know when their break is coming, they're not much different than adults. We need to know when a break is coming, and it motivates us to get our work done. It leaves us with less sort of downtime or ambiguous time. One way you can do that developmentally with the child is to watch your child and see how long they can stay on task. You can get a timer yourself and watch and see how long they stay on task, and then you can calculate your timer for each subject or task that you have, and then if they're 7 years old, then their break time their timer might be set for 3 minutes. If they're 12, obviously that timer can go up. So one of the last things, and this is a fun one, I think, and obviously developmentally with your child, 13 and 14-year-olds, this is not going to work well. But for young children, to role play with them, using stuffed animals, if you can set up, when I talked about that teaching environment, that school area, if you can set it up where these stuffed animals can be their peers, and they can have a teacher, and in fact, giving your child the opportunity to be the teacher and to create what's going to be taught, and get them in on the act so they can choose what to do for school that day. It can be very powerful in motivating the child. Last thing, JR, is teach your own way. We all have our different environments. We don't need to try to conform ourselves into being something that we're not. And just kind of decrease the pressure if you can, and teach the way you want to teach.
Yeah, well, and obviously I'm a parent too, and it's very easy for us to be hard on ourselves if we think we're not doing as good as the teachers, or we're not doing as well as other homeschoolers, and that we're wrecking our kids because we think we don't have the ability to take this on. And obviously people need to cut each other slack on that. These are some great ideas too. This mimicking the class environment, you said, the strategies to motivate, setting timers. I mean, I remember sitting in class, in high school classes, keeping an eye on the clock and thinking, okay, 15 more minutes, I can survive this. And then setting up kind of a virtual classroom is with stuffed animals and really fascinating stuff there. Now, Barb, let's go to you on this same thing. Anything you want to add that you've experienced as you've interacted with people thrust into this new role?
Yes, thanks. And I think Matt had some really great strategies. I would add to his comments about school space that desks are good, but again, at any dedicated space, so the kid is happiest doing their schoolwork in a beanbag. But just identifying that that's the space for school. And I think a lot of the strategies that we discussed are strategies that work with younger children that just might be adjusted or tweaked for teenagers, So having a schedule, like you said, school is very structured in terms of the schedule. But older kids can help you develop the schedule and have input into the schedule. And then they're going to be more inclined to go along with it. And I fully agree with Matt's comments about holding your ground. And that also means identifying the things that are not negotiable and maybe some things that are negotiable. One of the things that's challenging for everyone is, in terms of this pandemic, is the fact that things feel very out of control. And we feel better when we have some control over some things, and children and young adults are no different. So involving them in identifying the schedule, identifying the activities that are going to meet the expectations will help. And kids as young as 7 are really able to do that, and maybe even younger in terms of certain things. I think the other thing that will be helpful, a challenge I've heard is parents worrying about their ability to help their kids with the schoolwork. So staying in touch with school staff by email to get tips or asking them for help with problems will take some of the pressure off, I think. The last two things I would mention is that kids are really affected by how their parents are feeling, so taking care of them ourselves as adults and parents is really important. It's not selfish, and it will be critical to helping yourself and your student be successful in this really different environment. And of course, your kids have feelings about what's going on as well. Our kids all do. And there will be behavior changes, and there will be different ways that they do things, and not to be scared by that, but to acknowledge and understand it. School's not going to look the same right now, and that's really okay.
Well, and you raise a real good point. I mean, any of us who are adults, too, that are, say, naturally introverted are probably, I know that's my personality. Despite what I do for a living, my tendency is toward introversion. So really being told to stay home is like, oh, really? Awesome. Let's stream some Netflix. Right. But I feel really bad for people that are more naturally extroverted that are now being cut off from friends and hugging and some of these things that they might naturally want to do. And that, of course, is going to show up in kids, too. Kids that really thrive on being with other kids have got to just be going nuts right now, where maybe some of the others that are more quiet. So your point about understanding that it's going to affect different kids in different ways and being aware of that, that's great, Barb. Thank you. I want to stay with you, if we could, Barb Jewell from Sound Alternatives, as we move into another area here, and that's dealing with the fact that as this whole thing evolves, there the people's approaches and reactions are very, very different in terms of, in some cases, I should say, it's a situation like any other difficult one that is given to extremes in some cases. You see it obviously on the national scale with politics. We've seen some of it on the local scale with wearing masks. You know, some people think if you wear a mask, you're just cowering to the government and being a wuss, and other people thinking that if they see someone without a mask, that person just doesn't care if people die. And so given some of the toxicity that has evolved in this, and maybe not even to the level of toxicity, but speak to the differences in terms of how the pandemic is affecting people's different belief systems and behaviors, and if the stresses involved with that.
Yeah, that's a great topic, and I can't count the number of people who have brought this up with me to say, I don't know what to say to my neighbor, my friend, my family member. Their opinions are just so crazy. I don't understand how they can't believe X, Y, Z. I mean, there really have been some stark differences in approaches and beliefs and opinions in our community and in the nation, and people are really struggling with how to handle that. And I get it. I think, what I've been saying to myself as well as to others is that it's important to start from a place of empathy and understanding. I don't have to agree with someone to like them or care about them. In fact, we often don't agree with the people that we care about. But understanding what they're saying and even why they're saying it can help us remember our relationship and our place with them. And we can give each other permission to disagree. Because in this case, in some of these diametrically opposed opinions, I'm not sure agreement is going to happen. And it really isn't necessary. The other thing that I talk about is remembering what I'm in charge of and what I'm not in charge of. I'm not in charge of anybody else's opinions or beliefs or even actions around this pandemic. Mm-hmm. I am only in charge of my own thoughts and beliefs and actions. And if I feel unsafe with how someone is behaving or things they're saying, I have to stay away from them. Mm. Our responsibility is to keep ourselves safe and perhaps our children. And that's really the only thing that we can be in charge of. Respectful communication is at the core of living together in a healthy way. So being able to express those differences without insults or name calling or raised voices or threats. Because we're all going to have to live with each other after this.
Yeah.
And so I really think about the future and what I think I want it to look like in the future, and remembering that we're going to be here in this same place probably. So one of the things I tell myself is I want to be able to tell a good story when we're all through this. I want to be able to tell a story that reflects well on my own behavior, my relationships, my actions. I want to be able to tell a good story about my organization. And I want to be able to tell a good story about my community. And so I think about that, and that's what I'm aiming for. And I encourage all of us to aim for being able to tell a good story and a story that we're proud of in terms of how we handled this and how we went through it.
Yeah, well, and of course that really that's a good middle ground. To think, what do I want to, what if I was to have a legacy in the midst of all of this, what would I want that legacy to be? That I helped people, that I made a difference, or that I kind of lost it and went around, being sort of a vigilante type, Yeah, I mean, it's just, it's too small a community for that. Matt, how about some follow-up on there? Strategies for dealing with some of these extreme differences in thought and behavior that we're seeing. What are you encountering?
Well, well, the first thing that comes to mind, JR, is kind of counseling 101 for me, which is, I can't control other people's behavior. I mean, Barb touched on this a little bit, but we can build an environment in which, or help build an environment in which people can be successful, or more likely to be successful. But we can't control other people's behavior. And what we can do is control our own behavior. And one of the things that comes to mind is, I personally have a strong sense of justice, and I know that about myself, and that's not a bad thing. It certainly can be used to do good in our community. So, one thing I recommend in all of this is that, if you do want to do good, if you have a strong sense of justice, if all of us want to have purpose and meaning, and this is a trying time, and so go out and help somebody. Get involved in things that are going to help others get through this. Channel your energy and your emotion towards something good that, like Barb said, so that when we get done with this, we can look back and say, I did the best I could, and I feel good about it.
Yeah, I mean, as a perfect example, people that were concerned about what the airport might bring in the way of possible contagion, that have now channeled their energy into going out there and volunteering and being ambassadors. So do you want to look back on this and say, yeah, I went out to the airport and I protected the town by informing people that were coming in? Or was I somebody that drove around in my truck giving people the finger because they didn't have masks on? What kind of person do you want to be on the other end of this thing? So good strategies and thoughts. Again, thank you from both of you. Matt, let's stay with you now as we shift gears again, because obviously we've seen there's been an extraordinary amount of increase in stress and fear and anxiety and depression, things that exist in our culture anyway that have been made worse by the pandemic. And that can be people who already have some of these conditions that where the situation is making that worse for them, but also people that don't normally suffer from, say, anxiety or depression, that are suddenly having it come upon them and maybe not realizing 100% what's going on. So let's take those first timers, for example. What are some things that a person that perhaps doesn't normally have any behavioral issues, behavioral disorders, that's possibly going down the road of showing signs? What would be some things that would indicate to them that it's time to seek out some additional support?
Yeah, thanks, JR. Let me start by saying there are some big numbers for depression and anxiety in our country already before the COVID-19 pandemic. It's somewhere in the excess of 16 million people struggle with clinical depression, and 8 million or so with clinical anxiety of some kind. So it's fairly prevalent in our culture already, and the kind of uncertainty and fear that has crept into our culture over the past 3 months, 4 months is exponentially growing. That with people that already struggle from it, and those that may just now be experiencing some symptoms. So some symptoms to look for anxiety is hypervigilance or feeling on edge all the time, maybe being easily fatigued, difficulty concentrating, irritability, anger. I think all of us experience that when we get stressed. Difficulty falling asleep or staying asleep. So I throw those symptoms out there, JR, but it's good to kind of throw out the caveat as well that you can have one of these symptoms and not have an anxiety disorder or need help potentially. But these, if you're experiencing 2 or 3 of these on a daily basis, and they're just not going away, I would say it's time to reach out and get some help with that. Some other things with anxiety, panic. I think most everybody has heard about, somebody having a panic attack, or maybe they've experienced having a panic attack or panic symptoms. Those symptoms, if you have shortness of breath, heart racing or palpitations, nausea, trembling, things like that, chills or sweating, a lot of fear that's involved. And again, it kind of happens again and again, and there's a pattern. It's would be really important to reach out and get some help with that. Depression has got some, like anxiety. I call anxiety kind of depression's ugly cousin. They really oftentimes can go together. And there's a lot of people that struggle with both, and some of the symptoms kind of cross as well. So, of course, depression. Most people know that if you're feeling sad or hopeless, that's one trait for depression. Lack of interest or pleasure in activities, significant weight loss or weight gain, unable to sleep or sleeping too much, fatigue again, feeling worthlessness, inability to concentrate, recurrent thoughts of death or sometimes even suicide. So again, those are all symptoms of depression, but you really need to have 3 or 4 of those symptoms for consecutive days. Typically, it's about 2 weeks to see those symptoms, and then you should reach out for help. Now, I say that to say if you're feeling suicidal, you're having thoughts of hurting yourself, you should reach out right away. We have a nationwide hotline that you can call, and I'm not exactly sure. I think we've got a hotline here in Cordova, and maybe Barb, you can pipe in on that a little bit as we talk about some potential resources here. But those are the main things to look for anxiety and depression.
Okay, and 424-HELP comes to mind. Barb, is that still the Family Resource Center trouble line? Barb?
Yeah, so 424-HELP is CFRC's helpline. That's a phone that's going to be answered by a person who can provide assistance or get people to resources that they need. They can call 424-8000, which is the hospital line, which is connected to Sound Alternative's 24-hour on-call assistance, where they can be connected with a clinician. And there are a number of national hotlines as well, if they want to speak to someone outside.
Yeah, because that, of course, is always a concern for folks, too, although, we can emphasize with great confidence that privacy is absolutely paramount to the folks that work the helpline and who work in our mental, both Sound Alternatives and Ilanka understand that better than just about anybody. But be that as it may, even though your privacy is guaranteed with the local folks, like you said, sometimes people just feel more comfortable for whatever reason with somebody that they absolutely, there's no way that they're going to know or be familiar with. So what about any other phone numbers or assets like that you want to point out, Barb?
That's what I'm just trying to find my list. So can I give those to you after?
Oh, sure. Yeah, that'll be fine. I'll put them in the closing monologue. What about, Barb, staying with you now, following up on the information that Matt gave. Again, what we're focusing on at this point is that the pandemic adds stress, which not only can make people with say anxiety and depression that have it already, it can make that worse for them, but it can also start to become a problem for people who normally would not be considered to be suffering from those behavioral issues. So anything you want to add to that conversation, to what Matt told us?
I think Matt did a great job of identifying the signs and symptoms of anxiety and depression, and also identifying the difference between sort of a normal stress reaction and the kind of reaction that might require additional support. I think that one of the things that I would think about too is that stress in children can look a little different. And so while the symptoms of that Matt listed around stress and anxiety and depression for adults, with children, what you want to look for is significant changes in behavior that, again, last for more than a day or two. So if you have a child who is normally pretty quiet and steady and a little bit of an introvert, and all of a sudden they are becoming really demanding for attention of the adults around them, or in a lot of conflict with peers or siblings, and that, again, lasts more than a day or two. Those kinds of changes in behavior are the opposite. Typically, they're very outgoing and engaged, and all of a sudden they're more withdrawn, and that lasts over a period of time. Difficulty concentrating when they didn't used to, increases in aggression or disruptive behavior, angry outbursts. So again, paying attention to how kids are responding, kids and adolescents. And if you're seeing a really significant change, it might be time to ask some questions or seek additional support for them. And of course, as Matt said, any statements about not wanting to live or wanting to be gone or wanting to hurt themselves, obviously, you'd want to respond pretty quickly to that immediately.
Well, and there's obviously, for a long time, there has been a stigma regarding behavioral health assistance, which is really a shame. Having benefited myself from, because I had, all through my 20s, I had co-occurring anxiety and depression. Fortunately, wasn't tempted to self-medicate them, but suffered a lot and unnecessarily because I was resistant to trying to get help. And of course, our heads are connected to our bodies, just like any other part. If you bang your elbow and you think you might have broken it, you go and you see a professional who can do an X-ray and say, no, you didn't break it, or yes, you did, let's put it in a cast. If you're diabetic, you don't feel ashamed typically, I would assume, you don't feel ashamed going to a doctor to get your blood sugar checked and see if you need any medicine. Even COVID, this disease, if you have any of the symptoms, the shortness of breath, the fever, that kind of stuff, most people are not going to sit home and think, oh, yeah, I have all the symptoms of this disease, but I'm not going to go in and get any help. Well, behavioral health issues like anxiety and depression are not any different than any of those other things. And we have professionals that are available to assist in those situations. And I really hope, just based on my own experience and how much you two obviously both know about this, that people will recognize that this is a really weird time, and there is no shame in seeking help. And in fact, not seeking help could end up making things a lot worse. So I really want to thank both of you again for being willing to do this with us and to serve in the way that you serve. Let's kind of do maybe one last round for final thoughts, final comments. Barb, you first. Anything else occurred to you, or just what do you want to leave us with?
I think two things, and I really appreciate your bringing up the issue of stigma, and I would just reiterate what you said is all absolutely true, and that our mental health and our physical health are all part of our health, and they both affect each other, and it's really important to take care of our whole selves. STEM alternatives in Ilanka Clinic are both open in providing services through telehealth. We can be reached at any time, and we would much prefer to help people early on. The other thing I would leave you with, and Matt referenced this in terms of, one of the strategies is to go out and help. And Martin Luther King has a really great quote that says, "Be the change you want to see in the world." And I think we have an opportunity to be a really positive change right now, and I encourage us to do so.
Well, and something that is inherent in the wisdom of that statement, and in your suggestion that people consider that too. So often when people are asking for donations or asking to volunteer, it's easy to fall into the trap of thinking, man, somebody's just trying to suck more energy out of me. When in fact the reverse is very often true. That you may think, somebody's listening to the radio, they hear Barb saying, a good way to get me out of my funk might be to go help somebody else, to not worry about me, but go try and make life better for somebody else. So I'm going to drag myself out there and do that. And what they'll find is actually a very positive, invigorating, almost euphoric, in some cases, response to the basic joy that you can get out of helping other people. That's not a guarantee, but I've seen it happen in my life, and have certainly seen it happen with people that I know.
Just one other statement about that. Sometimes the change in the world I want to see is taking care of myself and my mental health as well. So being that change in the world can mean a lot of different things to different people. So that's something to consider as well.
Okay. Again, thanks a lot, Barb. Matt, any final thoughts, or what would you like to leave us with?
Yeah, thanks, JR. I too appreciate your comments about the stigma in counseling. It really is. Most of my clients, if not all of them, when they come to see me and build that relationship, they soon find out that it's not that stressful, and there's not as much anxiety and all the things that we think about it. Counseling, it ends up being a very wonderful thing in their lives. And so thank you for saying that. The other thing I want to touch on just a little bit is the third thing I think that America is struggling with more than others, which is substance abuse. It does tend to increase as stress increases. Human nature is to run from pain or kill pain, and oftentimes we might find ourselves self-medicating more and potentially getting ourselves in a position that we can't get out of with addiction and things. So I just want to say that we have the resources here to help with that if you're struggling with that. We've got some fine programs and good people, and and I think another barrier I think people think about is potentially is paying for services. I think that's important to talk about. Here at Ilanka, for sure, we drop as many barriers as we possibly can. So if you don't have insurance, and come see us. We've got a sliding scale. We've got a payment plan where you can pay $5 a month. We've got certainly Medicaid possibilities and other things, and so we are going to treat anybody that comes through our door. And we just want you to know that we're here.
Okay. And Barb, it's still fairly similar at Sound Alternatives, isn't it? Sliding scale and so forth?
Yes, the policies and practices at Sound Alternatives are the same as at Ilanka. We have a sliding scale, we have payment plans, and same approach. We're going to work with whoever walks in our door and needs services, and we'll figure out a way to do that.
Well, that's perfect. And this has been a great conversation. I want to thank you both again for taking the time out of what I'm sure are amazingly busy times for mental health professionals to visit with you. Stay on the line because I'd like to debrief a little bit afterwards, but for the purposes of the program, thanks again so much for joining us. It's been great to have you.
Thank you very much.
Thank you.
Boy, that was just a delightful conversation. Hope it was beneficial to you. Barb Jewell, Behavioral Health Program Manager of Sound Alternatives, and Matt Rush, Behavioral Health Coordinator for Ilanka Clinic. Those two facilities working together in very close coordination to make sure that the mental health of Cordova is the best that it can be during these very challenging times. I'm going to, by the way, provide the information that Barb and I touched on there briefly as far as assets, if you want to grab a pencil and jot some of this information down. And while we do that, I want to emphasize again, I know we just talked about it in the chat with Barb and Matt, but I can tell you from having served as the president of the Sound Alternatives Advisory Board for a number of years, I can't remember if it was 3 or 4 or 5, it was a while, and really any worries that folks have about contacting local assets with behavioral health concerns and issues, they understand first and foremost the importance of privacy. They get that. They understand HIPAA. They are completely devoted to that. And they are not going to let your personal information leak out or become somebody else's gossip. They get trained on privacy. Everybody they totally understand that. So if you're struggling, really don't be afraid to reach out for local assistance. Now, we'll start with local assets that you can call. There is the Cordova Family Resource Center helpline that we talked about there in the chat, 424-HELP. That's 4357, 424-HELP. Pretty easy one to remember. That's a 24-hour, 7-day-a-week helpline where you get to talk to a human. There is the Ilanka Community Health Center number, 424-3622. Sound Alternatives is 424-8300. CCMC's after-hours emergency line is 424-8000. Now, as they said, some of these non-emergency numbers can be called if you are feeling like you might be say you're a person who's not normally anxious or depressed, or if you maybe do fall into one of those categories and it seems to be appreciably worse to the point that it's getting debilitating. If it doesn't feel like an immediate emergency, you can wait a few days and kind of see if it's really, if you were just feeling off one day for a specific reason and then we're okay the next day. If it persists, then there are these non-emergency lines that you can call. However, if you feel like you want to harm yourself or others, if things are getting overwhelming, sadness, depression, or anxiety, causing you to feel like you want to harm yourself or others, you don't wait on that. That, by the way, is a 911 situation. If you're thinking that you want to take your own life or, again, commit violence against somebody else because of these overwhelming emotions. And this is not just during the pandemic. This is any time. That is a very justifiable 911 call. And our various medical and mental health professionals want you to utilize that if it's an extreme emergency situation like that. And also the CFRC helpline is for that kind of thing too, 424-HELP. Now, for those who want some variety, different perspectives on their conversations, or if for any reason are concerned about talking to somebody locally, there are also state and national resources. Here in Alaska, we have the 211 system, and that puts you through to a specialist who will work with you to understand your need and connect you then to the programs and services that can help. So 211 for information, 911 for an emergency. Another helpline is called the Substance Abuse and Mental Health Services Administration Disaster Distress Helpline, and that is 800 800-985-5990. Again, 800-985-5990. There is a texting option if you would like to open a dialogue on text instead of voice, if that's your preferred communication. You can text the phrase, "talk with us," make that all one word, "talk with us," and text that to 66746. Again, text all one word, "talk with us," and text that phrase to 66746. There is a domestic violence hotline, 800-799-7233. Again, 800-799-7233. And I think I will actually copy and paste this information onto our Facebook pages so that if you would like to be, we could put it in the description of the YouTube video too, because this whole show, again, as all of our COVID-related information is, this show is available for you to listen to again or recommend for somebody else to listen to anytime you want on demand at youtube.com/Cordova TV. And we could put this in the description of that as well. So I'll get all of this contact information, I'll get that on our KLAM and KCDV Facebook pages, and also any of you that are listening to this on YouTube, just look in the description for this video and you'll see it down there. So with that, I think we'll call it good. And again, even though it's a tough subject, I've got to say it's just a delight to have been able to visit with some very good and knowledgeable people about this difficult topic of maintaining good mental health in the midst of a pandemic and all the changes that it brings. Barb Jewell from Sound Alternatives, Matt Rush from Ilanka Clinic. I tip my hat to both of them, and to Cordova Wireless Communications for sponsoring our show, the Town Meeting program here on KLAM. Of course, any special programming that we missed in the 10 a.m. hour will still be brought to you here on KLAM on this Friday, May the 1st. It's a new month, which I hope is going to be a better month than this last month has been. Everybody be safe. Keep your chin up. Hope you enjoyed the program, and we look forward to having you with us next time for Town Meeting on KLAM.